Thank you for joining us this evening. This is the 7th episode of Health Huddle, where we discuss interesting topics about healthcare, wellness, and genetics every Wednesday at 8 a.m. So last week we took a break. This week we are back with exciting topics today. As you can see, today's topic is how the COVID-19 vaccine will affect your life and what's the new normal after the COVID-19 vaccination. We are here today with Dr. Chong here. Dr. Chong 𝗪𝗵𝗶 for us in the seventh episode of Health Huddle today, this evening. So before we proceed, let me introduce our speaker today. So Dr. Chong obtained his Bachelor of Pharmacy degree in 2015, and subsequently he obtained his Doctor of Pharmacy degree in University of 𝗬𝗹𝗪𝗂 a few years after. During his years of practice in hospital setting, he served in various tertiary hospitals, including Hospital Sedang, Hospital Putrajaya, and also National Cancer Institute. His experience in various referral hospitals earned him a vast experience in treating patients. Currently, he is serving in IMU as a lecturer of pharmacy practice. His area of interest is in infectious disease and clinical pharmacy. So, Dr. Chong, over to you to have a brief introduction about yourself.
Hi, good evening, everyone. So my name is 𝗪𝗵𝗵𝗶. So just call me 𝗪𝗵𝗵𝗶, it's good enough. So
Okay.
yep. So as John introduced, in fact, I was ex-classmate with John during our Bachelor of Pharmacy year. So subsequently, then I decided to further studies and try to serve for different hospitals to gain some experience in terms of like hands-on treating the patient. So day in and day out, we see a lot of infectious disease from last time until now. We have SARS, we have a lot of different kind of virus. Then 𝗪𝗶𝗶𝗃, now we have COVID. So do hope that we can share some information and have some fruitful discussion. Yeah.
Yeah, happy to have you here, 𝗪𝗵𝗵𝗶. So going ahead with our discussion today, so the topic is how the COVID-19 vaccine will affect our lives and what's the new normal after the COVID-19 vaccination. So this is actually part of a series of our COVID-19/vaccine talks. So if you are interested to know about the science behind a more in-depth of the science behind, do check back our video few weeks before with Dr. Jasmine. So today we'll talk about more on the practicality side of this COVID-19 vaccine. So now I will start with the overall questions of, I think, what we would be interested to know is what will happen after most of the population obtain the vaccine, and what's the new normal after the vaccination, 𝗪𝗵𝗵𝗶.
Okay, thank you for the question. So I believe that everyone have been asking, so what happens if I get vaccinated or I don't get vaccinated, right? So I believe the first thing that people would wonder, if I receive the vaccination, does it mean that I can just put aside all the SOP? I can do wear mask, I can just go around, okay, party, clubbing, or whatsoever, go into a crowded place, right? That would be the first thing people will ask. Am I obtaining my freedom right after my vaccination? The answer is unfortunately no. Yeah.
Why so?
Yes.
Why so?
Yes. I believe we have heard from our government that we have set a KPI, a target to get 70% of our population to get vaccinated. So until that we achieve 70% of our population to get the vaccination, I believe that we are not resuming back to our normal life, just like our back in 2018. Yeah, and it is quite a difficult task, given that our population in Malaysia is quite a difficult task to achieve 70%.
Okay, so talking about, there's a period where people get vaccinated. There are a group of people who are vaccinated and a group of people who are not vaccinated. So what should the people who has vaccinated do after they get their vaccination? And, what would be, the potential of sort of reinfection in that sense?
Okay, thank you very much. the first question is that after you get vaccinated, depending on which kind of vaccine that you receive, some requires you to take 2 doses and some just single dose, right? I believe most of us are aware. After you have your vaccine, still you need to practice the usual hygiene, wearing mask, try to avoid crowded place. Basically, you have to still practice the 3 C, I would say, avoiding the confined space, no close contact, and etc. And maintain a good hygiene. That is still a must until we achieve the 70% vaccination. Yeah.
So then many people would ask, right, for us to achieve 70%. So for people who are on the fence on taking the vaccination, would it be better to let other people to take the vaccine first and let the population sort of have the herd immunity while I leave myself out waiting for that to happen? Is that something that what's your point in that?
Okay. I think, right, this is no longer a personal issue to decide whether should I get it first or should I get it later. The COVID vaccination is no longer a want, but it's a need right now. Okay. I just going to show you a bit of statistics, if you don't mind. Right now, the government, our KPIs to vaccinate 70%, as I mentioned just now, 70% of our population. But if you look into these statistics, we have 0 to 14-year-old comprises of 23%. This is until 14 years old, not until 18 years old. Where right now we set the target to have those who are above 18-year-old to have vaccination. So imagine that our population standing at 40 years old and below is already standing at 23%. And in order for us to get 70% vaccinated, we really need most of the population in Malaysia to get vaccinated. And we have to exclude those who really cannot receive the vaccine due to any reasons, due to health reasons, due to any comorbidities that they cannot receive the vaccine. And we have to consider those who are not ready to get vaccine yet. For example, for those who are immunocompromised that need to undergo review, those who have allergy reaction, and also not to forget, we have a lot of foreign workers. Some of them, they are not even registered with Malaysia as a foreign worker. And that also actually contribute to the 70%. So in another word, we need everyone to get vaccinated. It's not a one, I want to get vaccinated or not, but now it's a need. We need you all to get vaccinated so that we can produce the herd immunity. Yeah. So that's, yeah.
Then does it mean that if we don't achieve 70%, there's no herd immunity in this sense?
Means that the vulnerable group, they are not protected. So try to imagine that your kids, I think the most vulnerable group that we are facing right now, first will be the kids, the 18 years old and below. They don't get vaccinated because now we don't really have a safety data to show that it's okay to administer the vaccine in them. All right. So that group, they are not protected. But that group, unfortunately, they are the most hyperactive group. They go everywhere. In the school, they will just touch their friends and play with friends. So they are at very high risk, you see. Yeah.
Exactly. Then what about, like just now I mentioned those that age 18 and below, they are not vaccinated. Would there be, a possible vaccination for them, or, at the current stage, what's the information that we have right now?
So at the current stage, there's still no data. I mean, for now, right, our clinical studies on this vaccines, so many types of vaccine, mostly they are conducted in adult population. So there are no safety guarantee that in the younger population. Until we produce a safety data on them, then only we can vaccinate them. So that will actually take some time. It is not like a few months, maybe it will take up a year or maybe more than that to actually have the safety data on them. Yeah.
Okay. As we all know, the vaccine that is available right now in the government settings are mostly 2-dose vaccines. So here's another 2 questions that it will be interesting to also discuss is, okay, first of all, if I'm on the 2-dose vaccine, I took the first dose and I accidentally or delayed in taking the second dose. So what will happen to me? And the second question would be, so is the 2-dose vaccine different from the 1-dose vaccine? So why does the government chose the 2-dose vaccine, namely, the Pfizer and probably the AstraZeneca ones?
Okay, and there are a lot of other 2-dose vaccine as well, not only that,
Yeah.
the Moderna also is 2 doses, right? So back to the first question, what will happen if I only receive one single, for those 2-dose vaccine, but you only receive 1 dose of vaccine, right? That will be the first question. So actually throughout the clinical studies, I mean, this is based on the population. We done the drug company actually done studies to actually see how good is the vaccine in protecting people against COVID-19 virus, the infection itself. So what happened is that in the study, they found that in a single dose of the vaccine, it is insufficient to protect. I would say it don't produce a sufficient protection against COVID-19 vaccine. But what they found is, given an additional dose of the vaccine, actually boosts up the protection up to 90% and above. So this is a very good data that we actually obtain. Yeah, compared to a single dose. Try to imagine that you are carrying a very heavy very heavy table across a 1 km, and at first you only have one person to carry it, and at the half of the journey you feel very tired, and you need someone to actually help you up, right? That is like how the second dose of vaccine helps you. It helps you to actually achieve the full protection. Yeah. In fact, right, COVID-19 vaccine is not the only one that require 2 doses. I mean, if you are familiar, the hepatitis B vaccine, it require multiple doses. The MMR vaccine also require multiple doses to achieve full protection. So it is not something like uncommon. Yeah.
So meaning to say, people who got vaccinated, they at some point of their lifetime, they will need to have booster jab as well, but it's yet to be established. More at the evidence of the duration or whatnot, right?
Yes. So far, because the vaccine itself is just released, we are yet to receive reports on the phase 4 clinical trial. Usually, for a medication or for a vaccine to be released into market, they need to go through 3 phases of clinical trial minimum. Phase 1, phase 2, phase 3, and the phase 4, it will be after they have marketed they have been released and been used, have been marketed, and they will collect data and see how good is the medication perform. So now we are receiving the medication, and what will happen is that the government, the WHO will collect all the safety data, as well as the drug company, they will collect the safety data, and they will see how good it will be. And then in the future, then we can generate data on what would be the optimal timing for us to get a booster jab. Or maybe the data generator will tell us there's no need for a booster jab. We are not sure yet. We are still not there yet. So now we are waiting for the result to come out. Yeah.
I see. All right. So we have some questions from the comment section. So let us go through them. So first of all, I think 𝗪𝗪𝗍𝗍 says hi. Says hi to you. So hi.
Hi.
So we have questions from Yuki on 2 questions. One is it okay for the under 18 years old being exempted from vaccination right now? So I think it's also a question of benefit and risk. So second question is the vaccine has a higher side effect or adverse effect in elderly population? So what's your take in that, Jibin?
One by one question. The first question, it will be about
exemption of vaccination on the less than 18 years old. So is it okay to actually exempt them even if without the evidence of the safety?
Okay. For now, they are not. I mean, in the registration of the vaccine registration itself, now we are not taking the under 18. This is for government Malaysia government. They are not taking under 18 yet. So for now, they are not in the queue. So once the safety data from all over the world is accumulated and we say that it is okay for them to receive, then only it will be released to them. Yeah. So right now we need to put we need to have a bit of patience lah.
I see. Okay.
For those
Then goes to
under
the
18.
second question. Is the vaccine has reported higher side effects, higher risk of side effects in old age population or elderly population?
Good question. So is it posting a higher side effect on the elderly population? At first, okay, this is the statistics all over the globe. At first, there will be reports says that it poses some risk to the elderly population. But soon, when the health authorities, including a lot of the safety health authorities that are taking care of the safety of the vaccination itself, when they do a post-event analysis, they found that most of the side effect, right, that serious side effect that happens in the elderly is not contributed by the vaccine itself, but it's actually their older age as well as their own comorbidity itself that actually contribute to the severe side effect. So actually, not really. Yeah.
I see. So technically, there's no enough evidence to say that it's higher. I mean, the side effects is also solely because of the vaccine. It's because also other reasons as well, right?
No, I mean the data generated says that it is not due to the vaccine itself. Yeah.
Okay.
So the blame is not on the vaccine.
Okay.
I know it's a highlight
the vaccine's
there.
fault.
Yeah, it's not the vaccine's fault. Yeah, I know it's a highlight there. Everyone says, "Oh, the vaccine, do something naughty on the elderly." Actually, it's not. Yeah, they have a pre-existing comorbidities.
I see.
Yes.
Okay. I will address I think Ms. Tan Xiaoyi's question on explanation of vaccine to reduce their fear later on in the webinar, in the session today. So there's another question that I would like to also bring up. I think in one question we can answer this. So just now we mentioned about double dose vaccine where it's there's a booster dose. So Yuki also asked whether double dose vaccines are actually technically better than a single dose vaccine.
Okay, good.
Yeah.
Some people will say single dose should be better because they only require one dose to protect the full protection. Some say that two is better than one. I even received a comment last time. People ask, can I take multiple different kind of vaccines?
Yes. Does it come with multiple protections?
Very greedy, very greedy. So say, can I take a different brand of vaccines? I got the money to spend. I mean, now it's not even in the market. But I think I want it. I want to have multiple vaccines so they have a very overall protection, very 𝗪𝗓𝗓. So for now, we don't really have data. First of all, the source itself, the source of vaccine, I mean the resource on it is very scarce. We don't really have enough vaccines right now at the moment to vaccinate everyone. So we don't really have the resources to conduct a study to say that, can I compare vaccine A to vaccine B and then say that which one is better, the two dose one is better or the single dose is better. And have to keep in mind that we are not sure that is it both of them last at an equal duration. Which one require a booster jab faster than another one? We have no data on that. And we have to take into consideration that when the clinical study was conducted, they are not doing together as a head-to-head comparison. So company A, they are doing their own research, and company B, they are doing their own research. And they are setting the population, the comorbidities, there are some variation also. In fact, even the location of the conduct of the studies and the virus itself might have some variation. So we cannot say that the data generate says that A at 95%, B at 99%, and B is better than A. There's no such thing unless we do a head-to-head comparison. Says that when we compare two vaccines under the same clinical studies and another one is better than A, then yes, we can conclude that. But right now, given the data generated from different companies, from a different research group, we can't say that one is better than another. Yeah,
I see.
We can't say that two dose is better than one or one is better than two. We can't say also. Yeah.
I see. So as long as there's no sufficient information, so we cannot make such a assumption. So it
Yes,
doesn't mean like any dosage or in terms of percentage effectiveness. So
yes.
however, that here comes another
But the
question.
highlight is that, sorry,
Mm,
the highlight is that we can't say that which one is better, but we can say that both
mm,
is working.
yep,
Yeah, I
definitely. The
think that will be
baseline
the
is at
key
least is
message.
working.
Yeah,
Yeah.
both is working. Yeah.
Mm. So then here comes another question. We know that certain vaccines. So for example, the COVID, no, the dengue vaccines, has a profound effect. Let's say if you have an infection, apparently. So for example,
Mhm.
if you took the dengue vaccine, chances are if you get infected in the virus, from correct me if I'm wrong, it will be
Okay.
more serious infection, than if you do not get the vaccine. So is there such a case, if you get vaccinated but you get infected with the virus, is get more serious, or it will be have a lighter effect after you get vaccinated?
Okay. It's a good question. So means that if right now I'm protected by the vaccine and we get infected afterward, will it
Yes.
be a more severe infection?
Or
Right?
severe or lighter infection, either way.
Yes. From the data that we know right now, first, the vaccine itself, it reduces the transmission. That would be the key point. And second, it was found that actually it reduces severity. If you get infected, it will not bad compared
Mm,
to the one those who are not protected against it. So that one, yep. So yes, it will reduce the severity. Yeah,
I see.
it's
So
a straightforward answer.
straightforward answer, it will reduce the
Mm,
severity. So technically, it doesn't cause a more severe infection. Rather, it actually offers a protection, at the least, if not. It's not like you get totally protected. There are instances who get vaccinated, they still get the infection, but it will be on a lighter scale. Am I right?
Yes, yes. In fact, that it will be the way that actually they've done the studies to compare a group of patients that receive the vaccine and compare to a group that does not receive the vaccine and how many of them get the COVID infection after the vaccination. So the data shows that, of course, the data shows that the vaccination protects the subjects from
Mhm,
getting a COVID infection. Yeah, that's how we are very sure that the vaccine is working
mhm.
and it does protect us.
That's actually good news for all of us. I think for people who has been vaccinated early on, for both of us, we have friends who are in the government sector has already been vaccinated.
Mm,
So then here comes again because we're talking about life after the vaccination. So we understand that COVID will not disappear like all our flu virus, influenza. It will just be controlled. Meaning to say, when we know that viruses would also evolve or mutate. In fact, currently COVID-19 virus itself has different variant. So
mm,
understand during the development of these vaccines, they are more focused on the more popular variant. So
mm.
right now, the vaccine that we are supposed to take, or that we are going to take, does it cover the other variant as well? So what if other variants come to Malaysia? So what will happen then?
That's exactly the point that we mentioned just now.
Hmm.
After you get the vaccination, you still have to practice good personal hygiene, wear mask, frequently wash your hands, and etc. And keep some social distance and avoiding a crowded place. Right now, we are facing a different strain. We are not only facing the major strain, but we're also facing the threat from a different strain, like the one from Africa as well as from Brazil, which is more found to be more virulent. And some data shows that the vaccine that we are having right now have a lesser protection against them. That's why even after you get vaccinated, still you need to be very careful. I think it is no harm
Okay.
to be more cautious because back then when we don't have COVID-19, I still remember some country like Japan, like Taiwan, so they do practice a very good hygiene. Wearing mask always, even though that you are not like feeling unwell or something. Yeah, so that will be one of the steps that actually helps you to prevent getting an infection. So first, uh, we control whatever we have right now, the popular strain, and we try to limit the more virulent strain to come into Malaysia and to avoid yourself getting infected with that virulent strain. Yeah.
Yeah, I see. Sometimes I think vaccines are also improving. Formulations are also being, keep on improving to cover more strains, more variants. I think this is what the
Yes.
pharmaceutical companies will be doing. So we have a question here. What happens if, let's say, between the first and second dose, if I'm supposed to get a 2-dose vaccine, if between the first and second dose, if I'm not mistaken, I think period of 14 days, what if I get infected between the days? What happens to the second dose?
All right. For this, right, is a commonly asked question also. So what happens is that if you get the first dose and get infected, so what you need to do is that you need to be quarantined. There's no doubt, right? So the second dose will come after you have recovered from your COVID virus.
I see.
Yes.
So meaning to say that it's still effective even though it's slightly later. So it will still be it will still be good to get the second dose after that.
Yeah. For now, the recommendation, it says that you can the gap that we actually allow is actually we recommend to have 2 weeks. Let me paraphrase it. So after the normal schedule, right, is the gap will be 2 weeks or 3 weeks, depending on which kind of vaccine. 3 weeks or a month, depending on what kind of vaccine you are receiving, right? So the current recommendation is that in case anything happen in between, let's say you face some health issue and you need to delay the vaccination, right? The maximum you can delay for now that we know is 6 weeks from first dose to second dose. But after that, we are not sure will you be offered the full protection as compared to those who receive on time. There will be protection.
Following on this, right? When you talk about extend more than 6 weeks, so let's say people who have really skipped the second dose entirely and wanted to go back again after 6 weeks, so should they restart the whole regime?
This one I have no answer on that yet. Yeah.
Okay.
Unfortunately,
Going too far. Okay.
Because now we are starting to vaccinate people, and we are not so sure that people, even the first batch that received the vaccine, right, they still haven't received their second dose. They are not time yet. So after they have time to receive their vaccine, if let's say they don't receive it, we are not so sure what will happen. This will be related to government's logistic as well. Yeah.
All right. So we
I hope that clear doubts. Yeah.
Yes. So we are here. So for those who just joined us, we are here at the 7th episode of Health Huddle, where we talk about life after COVID-19 vaccine. Today we have Dr. Chong here, Dr. Chong 𝗪𝗯𝗶 here with us today, sharing his ideas and thoughts. So feel free to drop us a question if you have any questions directed to us. So and we welcome any feedbacks as well. Just a short break just now. So coming back to the vaccine topic that we are talking about. So because the reason vaccination is in place, I think there's also talks about the COVID vaccine, so passport to travel interstate or even between countries. So do you think the vaccine offers enough protection for us to travel, even after most of the population is being vaccinated? So does it depends on the vaccination levels of the countries that we are going to travel to?
Okay. This is my personal opinion. Yeah. Okay. I think that it is highly depending on first, both countries, what's their vaccination rate. Secondly, what would be their active cases be like, and the infectious rate between both of the country. And third is also on the people themselves, whether they are practicing a good social distancing and good SOP, whether they are adhering to it or not. I think these are the major factors that determine whether is it safe to travel to that place. Yeah.
Okay. So it really depends on a lot of factors, and so for those who are looking into traveling after the vaccination, do keep in mind there are certain factors for us to consider as well. So understanding the virus nature, having different variations slash mutation. I think a few cases where people have in mind is, let's say if I get infected before and I recovered, and I get the vaccine, or vice versa, I get the vaccine full dose and I got infected and recover. So does it change my immune system towards the variant that I got infected, and also does it change the immunity that I have against other variants as well?
Okay, I think there are multiple questions in
Okay,
here.
so
First thing first.
let us start with
All right.
when we get infected, after we recover, then we get the vaccination full dose. So what does it offer me an extra protection in terms of immunity, or is it just the same?
Okay, if you get infected, okay, first thing first, whether does it offer you protection? I think that would be usually what people ask.
Mm-hmm.
Okay, so on top of that, we come to the second step, whether should they receive vaccination, and does the vaccination offer them protection or not, right? So I guess a lot of people will say, oh, I got infected before, so I should be protected.
Yes.
Actually, it's not the case.
Yes,
you still have it. It has been shown that we have cases that people who got infected with COVID before, and after they recover from it, and they get another infection. So there is no doubt. So when
probably
the case,
for the benefit of doubt, do you have the information to share why does this occur? Like typically
okay.
we would think that after an infection we would get certain immunity, right?
Yeah, there are some immunity. There are some immunity for those who got infected, but the immunity that generated from the first infection does not offer sufficient protection.
I see.
That's as simple as that. It don't offer you sufficient protection against another infection. That is why you need the vaccination that produce sufficient protection against the COVID virus.
I see.
Mm.
Okay.
So the third things that you ask, whether does it offer protection against other strain or other variants of the virus, right? More or less they do have some effect lah. But as we say, there are some mutation that is more virulent than another. So the more virulent one will definitely get the upper hand to infect you. It's not a full protection. We have to remember that it's not a full protection. That's why herd immunity is very important. The 3C is very important. Yeah.
As just now earlier in the session, we talked about the side effects in people with comorbidities, especially in elderly, is actually higher. Most of the cases of even severe cases are because of the comorbidities. Then would that ring a bell for people who have comorbidities to get vaccinated? So what's is there concern there?
Yeah, there will be concern actually for those who have comorbidities. I remember a few weeks ago I got asked by one of my friends, who so happened to have some disease that compromise the immunity. We also have patients that having a HIV infection. Then they wonder, should they get the vaccination itself? Okay, or maybe I would, or some of the chronic diseases like diabetes who also have weaker immunity. The answer is yes, they should get. In fact, because they are the higher risk, they are at higher risk to get the COVID infection, and they should get. But when they should get the vaccine is another big question. Okay, for diabetes is straightforward. They are the higher risk group. They should get as soon as possible. In Malaysia context, they will be getting it in the phase 2. How about those with on immunosuppressant, those on medication that actually suppress their immunity? That part, the current consensus is that they should actually seek advice from their consultant. They are treating them. The issue is right now is that because they are on the immunosuppressant, like let's say steroid or some of the medications that can actually reduce the immunity, we are afraid that the body could not generate sufficient antibody to when they are vaccinated. That would be the issue. So the consultant that treating the patient itself, they have to decide when will be the best time that the patient having a recovered immunity, or when they have reduced the dose of immunosuppressant and they are ready to receive the vaccination. Yeah. So it will have to, it will be based on the patient, a case by case basis. Yeah.
Got it. So for those who have friends or relatives that have special conditions, do remember to get more information on their condition before vaccination, and consult your doctors before making any move. So we are at almost the end of our session today. We have about 5 more minutes to go. So appreciate we can have hopefully one or two more questions before we end. So I think for us to wrap up here today, my last question would be, so not question, my last challenge to Chimpin here is, from your explanation, how would you address the fear of public in terms of having adverse effects or side effects from vaccination? How would you tell them to get vaccinated, to be, how to say, to comply to what the government suggests in terms of the vaccination plan?
Okay, very good question. For those who are not confident, they are worried about the side effect of a vaccine itself. I just want to give some statistics. Some statistics that actually let you all to be more certain about the safety issue of the vaccine. All right. I think most of us, we are afraid of the side effect from the vaccine will be the allergy reaction, the severe allergy reaction. Statistics shows we only have 50 cases of severe allergy in 10 millions of people who receive the vaccine. So that is equal to 0.00005% of you getting that severe allergy reaction. Meanwhile, general population, you have 0.6% of getting a peanut allergy. Seafood allergy standing at 2.3%. Lactose intolerance. If you are Caucasian, standing at 25%. If you are an Asian, 75 to 90%. So if you are telling me that the COVID vaccine is not safe, I think better don't eat anything. No peanut, no seafood, no milk, no cheese, nothing.
So the most severe thing is to get allergic reactions after a vaccination. So
Yeah,
but then the chances, yeah, so from what you are sharing, the chances are it's less likely to occur than peanut allergy.
Yes, 0.00005%.
0.005%. But what if people say, hey, that might be me? What about, it might be me?
Okay, here is the COVID vaccine administration process. So after you have done your registration, and then you have go through the screening, you're eligible to receive the vaccine, and you get the jab. And after you get the jab, you don't get to go home immediately. That's to protect you. For general public, healthy adults like us, you have to wait for 15 minutes. So the healthcare professionals, the doctor, the nurses, the pharmacists, going to keep you under observation for 15 minutes, because usually the severe side effect, it will happen almost immediately. So they will observe you for 15 minutes, make sure that you're okay, you don't have any reaction, and then only they will release you. For those at the higher risk of getting the side effect, they will keep you for 30 minutes. They are worried. The healthcare professionals like us, they are more worried than you. So you do worry. Let us handle the worry. Okay. So we are going to observe you for 30 minutes. All right.
All right. So just one last question from the comment section that we have here on the topic of side effects. So just now we talk about short-term acute side effects. So is there, because of the limitations of the studies and reports done on the vaccine, do we know of any possible long-term effects of the vaccination?
So far, unfortunately, so far we do not know any long-term side effect. But we do know that for those who experience side effect, usually it is very short-lived. It will resolve very fast. Does not pose any major issue on the patient. Yeah.
I see.
So that's what we know.
All right. So that's a very good discussion we have today. So for those who are still with us now, thank you for joining our session today. So that would be the last discussion that we have. So do stay tuned for our future Health Huddle sessions upcoming. We would announce the time and date soon in our page. So once again, thank you very much, Dr. Chong, Champion here today on sharing on your knowledge with us on vaccination today, and hope all our listeners get a very good a better understanding of the vaccine, and hope that you can share to also your friends and family. So that's all from us. Anything from you, Champion?
My last take-home message: don't worry, peanut is safer than COVID-19 vaccine.
All right. So that will be us signing off. So do take note, peanuts is actually safer. So thank you very much for.
COVID-19 is safer.
COVID-19 vaccine is safer.
Safer than
COVID-19 vaccine
peanut.
is safer than peanut allergies. All
Yeah.
right. So that's all for today. We are signing off. So thank you for staying tuned, and we hope that we have shared valuable information to you. Cheers and good evening.
All right. Thank you, everyone. Good night.
But are these supplements actually enough to supply your body with the nutrients in replacement of food?
Well, I think if you're asking